From emotional disorders to learning disabilities to mental illness, a Memphis practitioner has an alternative to traditional treatments that can actually help.
And it's something you may never have heard of. Leanne Foster and her husband use neurofeedback to help their patients welcome. What is neurofeedback?
So we measure brainwave activity with a quantitative EEG, and then we use high-powered equipment to train the brain to re-regulate itself. So when activity in the brain is outside of the normal limits and
like
causing
too much
problems,
emotional,
like
whatever.
for instance, a lot of ADD, the frontal lobes are kind of in sleep mode, so they're almost falling asleep at the wheel. And so we can train that brain to have a different habit in the frontal lobes so that it's wakeful instead of falling asleep during boring activities.
So speaking of this technique, who is it really for, and does it essentially work for most people or for whom?
So we have, over the almost 30 years that we've been doing this, treated everything from ADD, autism, all kinds of learning disorders, to anxiety, depression, traumatic brain injury, PTSD. The veterans can get this paid for through the VA if they get authorization. If we catch dementia early enough, we can help to slow it. And we've also worked successfully with tinnitus and vertigo.
Really?
Yeah.
So is it a matter of, you see where, I guess, the blood flow is, or the activity by brain activity?
It's the brain wave activity.
Okay,
so
and you redirect it to the correct...
The system uses operant conditioning to retrain the brain. So people watch a movie, and when their brain begins to re-regulate in the areas that we're training it, the movie will get big and loud. And when the brain stops re-regulating, the movie shrinks. So as the brain notices the movie getting big, it delivers itself dopamine, which is the neurochemical of learning. And then over time, it maps an entire new pattern.
How long does it take,
typically?
typically?
Would you have to come in for several procedures, or how often?
So the veterans, for example, are very complex cases, as you can imagine, and they get 30 sessions typically, unless there's seizure activity, and then they get more. And how long it takes, if you do more in a short period of time, your brain trains faster. So we have a lot of parents who bring their kids in the summer and do intensives for a couple of weeks and find some pretty amazing results.
And is it one of those things that once you've retrained the brain, does it stay that way, or do you need to come in for like a tune-up periodically?
It stays that way unless, of course, you've had something like a traumatic event or an accident, and then you need a tune-up. A lot of kids that we've trained with ADD will come in when it's time for ACT or GRE and just do a few sessions.
Sure, that makes sense.
Are these, in many cases, older children, or in some cases, do you see smaller children as well?
We've seen kids as young as 3. If they can sit in the chair and watch the movie, then we can train their brain.
Wow. It almost sounds like, particularly if it can slow down or prevent dementia, it almost sounds like anyone, regardless of whether you're having trouble, is the normal brain, I don't like to use that word, but does it still need some help sometimes?
Yes, so we have some executives who come in and say, you know, my parents are showing signs of dementia, and I don't want that, I'm not seeing it, but I want to be at the top of my game. So we do use it for peak performance.
Really?
Yeah.
And I'm assuming, given the way our health care system is, that insurance does not cover this. It's too alternative or whatever. Give us an idea of roughly, is it the number of sessions you need, or what your disorder is, or how
so it does vary person to person, but if, for instance, you were like one of the veterans and did 30 sessions with the brain mapping, you would be looking at around $4,000.
Still, wow.
Have you run into some cases where it may not click for that individual, though?
There have been some cases with very complex depression, where there's been many years of medication that have kind of dulled the brain, where it's kind of difficult for the brain to move beyond what the medication has done.
That makes sense. The brain is such a fascinating...
Thank you so much.
Thank you.
Wow.
Appreciate you being here.
We've put on